Hi everyone. So I'm going to talk about the development of an online STI clinic that we're developing in Victoria, Melbourne at the moment. So firstly, I just want to acknowledge the traditional owners of the land on which this project was run and pay my respects to elders past, present and emerging. So why are we looking at building an online STI clinic? Because we know in the context of Australia in the last 5 years, STI notification in Australia has risen, as in everywhere in the world. Gonorrhea is up, syphilis is up, chlamydia is up, and particularly we see this in young people. So on the demand side, we see that there's also people wanting more prep visits and more doctor time. There's also a desire to have a private and convenient way of getting tested, and also COVID-19 sparked this digital age. And on the supply side, sexual clinics in Victoria, particularly in Australia and Victoria, we're at capacity now. In Melbourne Sexual Health Centre, where I do a lot of work, they're already turning away people now because they can't fit them in. If you try to get a GP appointment in Victoria now, it's quite hard. And particularly if you live in rural areas in Victoria, it's even harder. And this is in the face of reduced government funding as well, so it's getting harder and harder to get an appointment. There's also a response to emerging markets where we're seeing a lot of private practitioners now coming in and providing services. So what we're doing now is I'm just going to take you through the design of this online STI service and what it's needed. So you can see in number one, what we're trying to do is to respond to the limitations in current services in STI testing. We're trying to understand what young people want from an STI online clinic, trying to then balance optimizations and feasibility of running such a clinic. And then because this clinic is going to be run in particularly rural areas where there's going to be less services, how do we integrate an online service to already existing services in those areas? So just a quick background. So online delivery services obviously already exist. You have one in New Zealand already. So we're kind of basing this on two well-established models, one in the UK called SH24. This is a self-sampling kind of a testing system where you go to the National Health System, you're offered a test, the test kits are then provided to you in the post, treatment is then provided through a post or you attend a clinic. And through these evaluations, they found that this type of system can increase STI testing and reduce the time to test, but it didn't have any change in the time to actually receive treatment. And there's another one in Canada called Get Checked Online. In this one, you get a form. You then pop into a lab to provide your specimens. You then attend the clinic for treatment. And this study was found to be well attended by MSM in high-risk populations, but only about 37% of them who actually created an account actually resulted in the specimens actually submitted. So about 2/3 of them dropped out by the time they enrolled and lined in the beginning to actually finishing the submission. So the aims and objective of our project in Victoria is to reduce the burden of STI and HIV in the population by increasing access to testing and management by a comprehensive online STI clinic. And so far, we've now come up with a name, and the project's going to be called Test It. And you can see the bolded ESTI, that's supposed to represent the online or digital electronic STI testing. That's taken 6 months to come up with that name. So the objective is to develop an online testing service that is co-designed with end users, that's young people, particularly in rural areas, to evaluate it for usability and acceptability, to then evaluate its impact on diagnosis rates, testing rates, and partner notification, and then evaluate it to see whether it's cost effective. So this is a 5-year project in 5 phases. So you can see end users are all in the middle of this process. So we're going to start out with a systematic review of what online testing looks like already in Australia. We're then doing a survey of young people to find out what they want, get a small population of these young people into a co-design workshop to talk about the nitty-gritty of the look and feel of the website. Then looking at if we're going to roll this out into rural areas, what that's going to look like in terms of stakeholder consultations, how does this fit into local councils' plans. We have this thing called primary health networks in Victoria, which is kind of a conglomerate of GP services. How would GPs fit in, nurses, pharmacists, pathology providers, and community organisations. Once we've got this website, we want to test it for acceptability and usability, and then we're going to evaluate it, as I mentioned before. So let's talk first about the limitations of current services. So the issues are we have now testing is not particularly comprehensive. There's non-adherence to STI guidelines. So these are online services that we have currently online. So when I mean testing is not comprehensive, some places only provide testing for urine samples, but they don't provide testing for HIV and syphilis. that kind of limitations. Some private owners and private companies that I'll show you later that actually provide STI tests that aren't even recommended by guidelines. There's a lack of linkages to treatment once you become positive, and there's particularly a lack of integrated health promotion. So our service, as I mentioned, is to provide this comprehensive service managed by a clinic called Melbourne Sexual Health Centre, and Melbourne Sexual Health Centre is Australia's largest sexual health clinic. So I mentioned before, we're going to give testing, treatment, and partner identification. How will this integrate into existing services, build around what young people want? So this service is free for anyone that holds a Medicare card in Victoria and Australia, but it will be fee payment otherwise for international students, so that's going to be a limitation. So the barriers of face-to-face consultations, we know that having time to visit a clinic, stigma, privacy, distance from clinic, and a whole variety of other issues are reasons why people might prefer to have an online clinic. But we're mindful that there's lots of studies to show that if we build this online clinic, that we don't increase barriers to service testing. So previous studies have shown that online clinics can advantage younger women and white populations as opposed to other more deprived populations. They might actually be better. They might actually serve people that lived in less deprived areas, or they might serve people who live in urban residents and heterosexuals, which might be at low prevalence of infections or already have access to services. So when we design these services, we're mindful of these studies. So the first part of our study was just to review what web-based services in Australia already look like. So if you go online now in Australia and you go online to get an STI, HIV testing, what do these private services look like? So this was undertaken by my PhD student, and what he did was he reviewed currently the 17 services that you can log into in Australia to get testing for HIV and STIs in Australia. So at this time there were 17, and of these 17, 8 provided home testing kits. So you log online, they send you basically rapid testing kits in the mail. 2 of them were self-sampling, so they send you a kit of tests, you self-sample, and then that's then posted off to pathologies. And then you got 7 what we call self-navigated pathology, which is kind of the main, what you would expect. They give you a pathology form, you take that to your nearest pathology form. So you get a home testing kit, you provide a sample, give it to a lab, or you pop into a lab and they test it there. So what we assessed this for was whether these services were publicly or government funded, or whether they were private, what the out-of-pocket costs were after you got Medicare to pay for some of your costs, whether they provided services to people who spoke a language other than English, whether there was a minimal requirement. So in Australia, I'm sure in New Zealand, that to access these services, you need to be 16 plus years. So obviously, if you're under 16 and you're testing for an STI, there's concerns about lots of things. And so whether or not these websites had these safeguardings around harms and abuse, whether these were reliable or credible websites, whether these had high quality. So in terms of some quality requirements, we looked at whether or not the tests that were provided were in those recommended by ASHM, whether they fit the regulatory frameworks of the Therapeutic Goods Administration, which is our drug regulatory authority, and also we use existing standards from the UK who have some standards around what online services might look like. And also, then we also want to look at timely access, so how long it took to get those kits to you before you got a result. So with the HON guidelines, so these are the HON guidelines is about, the HON code promotes the effectiveness and reliability of new technologies for telemedicine and health. So basically this is the golden standard of what an online service might look like. So they have these criteria where an online website, to be a good online website, needs to be authoritative. That means they tell you who the qualification of the authors are. This service that this online provides must be complementary to an existing service. It's not to replace GPs, it's to complement them. It obviously gives you privacy. It gives you attribution. So if they provide any information on there, it should cite the information and the sources of where that information came from. It needs to be justifiable. So what they're doing is justifiable in terms of benefits and performance. Transparency in terms of if you need to contact somebody about some issue, that they've given you some contact details. Financial disclosure, whether, for example, drug companies be involved in developing this website, and also advertising policy, clearly about advertising, whether or not that's been involved in the development of a website. So we use this as one of the criteria of these websites that we assessed. So this is a summary in the paper. It's being published now. You can see the thing. So you can see here. I'm going to try this Fandangle thing here. Oh, here we go. So here these are the 17 websites that I have. And in terms of the funding type, you can see it's private or publicly funded. And then this self-navigated pathology and stuff is what I mentioned before. And then when we looked at testing, these are the tests that we're looking at, whether they provided testings for these conditions and then whether they then provided testing for all 4 of them, and then whether or not Medicare then kicked in and paid for some of them as well. So what I want to show you now is, so I mentioned the testing that was provided, and these are the costs. So you can see, for example, InstaScripts there. InstaScripts got quite a lot of popularity in Victoria. You can see that if you have all 4 tests, it only costs you $20, and you do require Medicare to run it. And you can see the costs running down that column on the right. They vary, and I want you to point you to particularly one of here. So this is better to know. This costs you $600 if you want to get a full comprehensive STI kit. So that's now on the radar. We've been speaking to ASHM about developing some guidelines around these type of websites and these private organisations about whether or not they should be doing stuff like this. So we're in the process of providing something to ASHM, and they might do something about it. So you can see they vary. You can see that some of them are really expensive, and we think it's a little bit ridiculous. So in summary of these 17 services that you can get in Australia, only 4 services actually was able to test for all the 4 STIs. That's your bacterial STIs, syphilis and HIV. Not all recommended the 3 swab sites for MSM, so for genital, bum, and the mouth. Some offered tests that weren't recommended by guidelines. Example, some of them provided tests that weren't TGA approved. So one of the websites sent point-of-care tests from Singapore that you just sent it to your home. They assumed that it was accurate and that you would use that. Other offered testing such as uroplasma testing, which is not recommended at all. So they basically send you a product you don't need. So a lot of them have provided insufficient clinical information collected from the users. So if you're going to test somebody at the various sites, you kind of need to get a sexual history or some clinical information. A lot of them didn't ask you the appropriate questions to get that decision making. Only one site provided information for non-English speakers. And scarily, one site allowed a person under 16 to have actually access to services without any safeguards. And the 7 had age criteria of like you had to be at least 16 or 18 years to use it. A lot of them lacked any health promotion material. And because most of these stuff relied on Medicare to fund it, there was obviously disadvantages in Medicare ineligible people such as international students or those on bridging visas. Only one website actually offered treatment, and that was only for chlamydia. And so overall, when you look at all the data, the best quality service was those that were publicly funded and those where you had to go to a pathology lab. So basically what we found was that if you got a website and they send you a testing kit to test at home, they were poor quality, so don't do it. So what we also want to do is looking at this stuff here. So looking at those different methods of testing, the top one going to a pathology service. What we try to do is then look at the estimate time of testing. So the gray part looks at how long does it take you to actually get the test. So you can see at that top row, the self-navigated pathology where you go to a lab. We assume that it takes you, once you get a pathology form, it takes you 1 day to go to a lab, and then it takes 3 days for you to get a result. So overall, that system takes you 4 days. If you're doing self-sampling, we assume that you've got to go online, order the test kit. It's going to take you probably about 4 or 5 days to get in your mail. And then by the time then you deliver it, then you have to post it back to the place to get a result. It takes you about 12 days. So this is being conservative that Australia Post actually does what it's supposed to do. But so interestingly, it's self-testing. So these are the people that send you these like instant point-of-care tests in your home. It takes about 14 days to get these results. So while people in their mind think that, if I get this kit in my home, I can do self-testing, it's really fast. It's actually the slower system because in COVID, so what we did in this study was we actually went online and ordered these tests to see how long it took. We sent it back, how long it took. So we tested this whole system. And in fact, so that last one when they sent you a home testing kit, it actually took you 14 days for us to get that test kit in our homes. And the first time we ordered it, it actually got lost in the mail. So I suppose that's the thing we need to tell users that point-of-care tests, home testing kits aren't always the best system because you still got to wait for the post system to. And also the other things about these point-of-care tests is that all of them will say if you're positive, you need to go to a GP and confirm that test result anyway. So you've got another step anyway. So it's actually really not a way to go in our opinion. So what we're trying to do now with this paper is now provide some consensus guidelines of what makes a quality STI online clinic in Australia. So there's already some places that already do this. So there's some standards from the US ASTA about collecting samples and sending to pathology in terms of self-sampling. So there's guidelines around that in the US. There's also standards for online and remote providers of sexual and reproductive health services in the UK. And currently, like I said, we're in discussion with ASHM about developing national standards for best practice for online services. And so going back to our project, this is a collaborative project. So these are our partners on the right-hand side. So this is funded by the National Health and Medical Research Council and the Health Department. So this system is building on the infrastructure and the services of Melbourne Sexual Health Centre. And we've got collaborators. So in terms of youth engagement and co-design, we're working with YACVIC, which is the Youth Affairs Council of Victoria, and also the CEH, which is the Culture, Ethnicity of Health. So in these two populations, we're trying to recruit young people from diverse communities to do co-design. In terms of rural, there's a public health funded, there's a Victorian Health Department funded group called SEARCH, which is the Centre for Excellence in Rural Sexual Health. And in terms of other services that live in primary care, we've got Sexual Health Victoria, which is that works in sexual health field, Royal Australian College of GPs and these primary health networks. And then we've got technical people. So in terms of e-prescriptions, we're working with Fred IT, who's one of the largest providers of electronic prescriptions in Australia. In terms of marketing and branding, we've hired this group called Paper Giants, and the technical aspects of building this online clinic is a group called Five Faces. So it's a massive undertaking. So the second part is how do we attract young people to use this service? So this is about the co-design process, and this is going to talk about the language, the color, the feel of the website. So the process is that we want young people to inform us what the colors look like, what the wording is like, all that stuff in terms of interface and functionality. So we held 6 co-design workshops of Victorians aged 16 to 29. We recruited people from metro, outer metro areas and rural Victoria. And then we ran workshops about what people expected, what type of messages they were happy with, and basically what did they want from the service so we can start building around it. So what we did with some key findings in the workshop. So we had the type of messaging and tone. So for example, we said to them, what do you think about this comment? It's confidential, affordable STI testing, found out more. So these kind of comments, we then talked to them about it, and what they found in the end that from this website, they wanted the service that had clear service offerings. They want terminology, obviously, that was easy. And around messages such as be healthy, be safe, get tested. They wanted the messages to have a positive tone. They wanted to be playful, not alarming. And they particularly want the language to be inclusive and represent diversity. And in terms of functionality, they wanted this e-clinic to be a resource, not just a testing service. So they wanted resources to contraception, et cetera, They wanted transparency regarding what the testing process looked like and information they needed to collect. So for example, this would be like, what does it mean to be tested? What do I need to do when I get tested? What do I need to bring to the pathology form? All that kind of stuff. They also wanted to maintain privacy online, and especially when they got tested. And obviously they wanted to be secure and private like everything else. So these images on the right here. So these we posed to them a few variety of images. So these images were, do you want images that are more professional? Do you want images that are a bit more abstract? Did you want stuff that talked about relationships and things like that? So they didn't like at all the relationship one at the bottom. And they kind of wanted in the end a mixture of the top two, something that was a little bit abstract but mainly professional. So it was interesting for us. They didn't want things that were groovy and fun. They wanted something that was professional. So the sticky bit. So this is now trying to start about working out the actual digital side, the technical side of building this website, and this is a mess. So this is just an example of the types of things that we need to work on at the moment. So the things we have to work with, this is the old client who then comes in. That information they provide needs to then work with Melbourne Sexual Health Centre, and this is a portal that we're building. This portal then needs to deliver a pathology form to the pathology labs. The pathology labs then provide results back to the clinic. The clinic then has to do stuff internally. Clinic that has to provide treatment that has to follow up. So in our system now, we've got to link up this new ESTI system to 4 different types of service providers, and it's a massive challenge. So at the moment, in terms of pathology labs, there's no way that we can send a lab pathology form to a client that they can take on to a phone. At this present time, they still have to print it out and take it to the lab. So we're hoping by the time a year's time when this project starts to roll out, that pathology labs will start to be able to have digital pathology forms, and they're telling us they will do. And in fact now, this was about 4 weeks ago that this slide was made. We've had to now build a new technical thing inside Melbourne Sexual now to link up all this stuff. So it's a big process. So I'm just going to take you through the different aspects and the challenges that we've had in this online clinic, and this is a user journey. So we're looking at starting from going online and getting a consultation, putting all your information in, then getting tested, then getting results, then getting treated, notifying your partners, and then retesting. So I'm going to take you through these steps and the challenges that we've had. So take you into the online consultation. So following down this section here. So you enter your website, you register your details, you answer some sexual health history questions, example with symptoms and sexual activity, and then you then prescribe STI or HIV tests as appropriate to your sexual history that you provided. So what we currently learn is that there's going to be some mandatory questions that we're going to have to ask, and young people are okay with it, but they need a justification. So obviously we're going to ask them a lot of sexual behavior questions because we want to know which side in their body that we need to test. So we're trying to move away from asking people's gender identity or their sexuality, because in the work we're doing, we just need to test the site. We don't really care about anything else, even though that's important. So we started asking things about, did you have sex with someone with a penis? Did you have sex with somebody with a vagina? And that obviously caused issues in young people going, why are you asking that question? So all the way through, we have to explain to them why we're asking these questions, because they're obviously quite intimate questions. Obviously, some young people prefer online-only consultations if they had no symptoms. So if you had symptoms, they want to chat to somebody. And in fact, at the moment, if you've got a symptom and you're registering for this service, we'll send them a message to say, we think that it's more appropriate for you to see a GP rather than use this service. Please do so. And then things about multi-factor authentication, data security, and confidentiality. So we think about things like when you log into the service, a message will come up saying, will you allow us to use your token to collect information about you? So we're making explicit to them about what information we're collecting them. They can not consent about it. We're also thinking about stuff like if you use this service and you haven't gone back in 3 years, we delete your data. So it's stuff like that we just don't hold in your data forever. And so in terms of eligibility, we're thinking about should we include those with symptoms and which symptoms. And also a second part of this project will be at some stage later on whether or not we provide an online PrEP clinic that's just for PrEP prescriptions instead of having to go in the clinic. So the second part is here about getting tested. So the option is pretty much the only option we're providing is attend a pathology collection centre. So what we need to learn obviously is that pathology forms have to be electronic, because if you get a young person to print off and bring it on, they may not have a printer, they don't want to do it. Originally, when we developed this service, we wanted this idea that you didn't need to have a telehealth appointment with a doctor to get the pathology form. But since we've now started this project, Medicare in Australia have been very alert to the fact that lots of services online now are not requiring people to see or talk to a doctor and then prescribing them a pathology form. And Medicare are alert to it now, so we've had to change it to now when somebody needs a pathology form, they actually have to have a quick telehealth with a nurse or something before they get a form. So this limits our click and collect system. And obviously we want stigma-free pathology services. So an evaluation of a New South Wales health service recently found that people, for example, trans people who rocked up to a pathology centre were dealt with stigma and a whole pile of stuff when rocking up with the pathology centre. So we already started talking to pathology centres in our project to say, are you happy if we chat to you about resources that would help your staff be able to understand your client base and kind of be prepared for them. And under considerations whether there's access for people without Medicare card. And at the moment you can, but they'll be charged. So I'm not sure whether they'll continue to do this if they get charged. And the other option would be then to do online at-home self-collected testing. So at the moment, so in this picture here, at the bottom, that one there. So there's an organisation called Search, which I mentioned before. They've started rolling out vending machines across some sites in Victoria now. So a young person rocks up, they enter some details, this box pops out, and in the box is like all your testing that you need for everything except for syphilis. So what we're considering now is whether or not we can provide some sort of home testing kit. It's not going to happen, but we're just thinking about options. So whether there's financial and logistical challenges. We know from previous studies in Australia that if you send people a posting kit in the mail, there's actually poor return postal rates. So in the studies that we've done in Melbourne Uni, the return rates are less than 50%. In Amsterdam and other countries, it's much higher, but in Australia, we found really low rates. So it's expensive to get someone to go through a system, post them a kit, and then they don't bring it back to you. So there's also issues about a lot of these tests not being covered by Medicare. So if you, at this point in time, we've not devised a way where we can send a syphilis testing kit in the mail. And if we did manage to work it out with our laboratories, it would have to be paid privately. Medicare would not fund it. So HIV, in Australia, we're using stuff like the Atomo. I'm sure you know about Atomo. It's a home testing HIV testing kit. It's the only one in Australia that we can use that's home-based testing for HIV. So even when we try to pack that HIV testing kit into that machine in a box, TJ wouldn't allow search to take the kit out and put it into their packing box. It had to remain in the original box that it was packaged in. So it meant that the box that they used in that machine is massive, but that's fine. So the other options would be whether or not you have these testing kits sitting in pharmacies or community health centers. People rock up, pick them up, go home, test it, and bring it back. So these are things that we're exploring, but it's mainly this will be phase D or Z of the project. So receiving your results. So if you're negative, you'll receive a test electronically by email or SMS. It's probably going to be an SMS, and we've worked out now that it's likely to be a message on your SMS to say, hey, you've got your results, please log into your portal and get your results. So it's not going to tell them anything about the results. And then if you're positive, someone's going to call them and chat to them about it. And we found that SMS was acceptable, notify them checking the portal and a web link for results. And we're under consideration about telehealth for all or some of the STIs. So at the moment, I think now we're only going to do a telehealth with somebody with syphilis and HIV, and I think gonorrhea, we're not going to have a telehealth, or chlamydia, no telehealth. We're just going to tell them they've got, when they log in, they'll have a result. A referral letter will be sitting there. They can rock into the clinic, or they use the referral letter to go to a GP. So remember, this is an online service. We want to minimize the amount of time a human being has to be in contact with these persons, otherwise it's not an online clinic. So in terms of treatment now, so chlamydia treatment is really easy. It's doxycycline, so it's easy to get them an e-prescription. But injections are much harder. So queer individuals prefer sexual clinics over GPs in our study. There's also this issue with gonorrhea treatment that ceftriaxone needs to be injected with lidocaine. And I did a survey around some pharmacies about whether or not they stocked injections for syphilis and gonorrhea treatment. So some pharmacies may not stock the ceftriaxone. Definitely not all of them keep the benzothine penicillin for syphilis. And in fact, in Australia, I'm not sure what in New Zealand is like, they come in a box of 10. So pharmacies won't order it because it's too expensive to hold that stuff. So at the moment in rural areas, they just grab this from a doctor's bag, which is free. So if the setup is done in rural areas, they'd have to have a connection with a doctor to get the syphilis injection. Whether or not, if you live in a rural area and you're positive for syphilis and gonorrhea, how will you get that injection? So do we refer you to a GP or do we refer you to a community health centre? We've already had some consultation in the community that GPs don't like us sending it to them because they're already busy. And what you end up doing is you just say, oh, you're positive, here, go and see your GP. But if the GP is not available, you're just basically washing your hands of them. So we want to make sure that services are available before we send them on. And in Victoria, we have these things called super care pharmacies. There's a variety of them where they're open 24 hours a day. And in the evenings, there's a nurse. So it's a potential that people can rock up to these super care pharmacies and the nurse can then inject them as well. So other considerations, whether we get referrals for gonorrhea treatment, and then a warm referral, someone with syphilis, HIV, we'll link them up to a service that's in that area for that young person by that doctor or nurse calling the local service and say, hey, X has got this diagnosis, we'd like you to see them, so that's a warm referral. And there's still lots of work to be done in terms of potentially training pharmacists to inject injections. So we're now thinking whether or not we can train pharmacists to inject these syphilis and gonorrhea treatments. So in terms of notification, what we've learned that people prefer an anonymous web-based tool for partner notification and interest in digital links. So at the moment in Victoria, there's a system called Test Me. You go online, you put your sexual contacts details in, sends them an anonymous email or SMS to say, hey, you've been in contact with someone with an STI, please get tested. And the other consideration about whether we send reminders to positive individuals about retesting. So, currently in the guidelines is that if they're positive, they have to be retested in 3 months. But the issue we do that is you drive people back in the service and maybe then use up time in the service. So we're not sure whether we'll do that. So in terms of billing, so Melbourne Sexual Health Centre currently is a free of charge service. They charge everyone on Medicare. But if ESTI is to run and you've got no Medicare, how are we going to charge these individuals in the clinic? So they would have to set up a billing system. So at the moment, we'd have to set up a digital signature for Medicare rebated consults and for the tests. And currently it's paper-based, so the physical signature by doctors. And they would have to set up some way for these people to pay for the services as well. So the last part is about building pathways for service integration, particularly in the rural areas of Victoria. So this is you're a young person, you're in Victoria, a rural area, you're positive. Where do we send you in those areas to get treatment and health promotion? So in Victoria, we have these things called local government areas. I think you have similar ones in New Zealand. So here I want to talk about one particular area called the Loddon Mallee area. So this is Victoria down here, obviously. So the Loddon Mallee area, so if you look at Victoria and you go over here, that map there, you can see that blue part is the Loddon Mallee area. That blue bit represents about 26% of the area of Victoria. It's the largest Victorian region. It borders 2 states, so it borders South Australia on the left and New South Wales on the right. So what that means is I work a lot in one of the border towns up the top there, where people in Victoria who can't get services in Victoria will cross the border in New South Wales to get testing. And similarly, they'll go to South Australia if they can't get testing in Victoria. And then in this area, there's about 350,000 people. There's high culturally and linguistically diverse populations. Up to 5% are Indigenous, and there's about 12% of them are young people. So the approach to rural implementation is that what we're trying to do with this project, we're going to pilot this online STI clinic in specific rural metro areas where there's a need. So we're targeting these promotion in these areas where there's low access to services and low testing according to notifications. And we're going to be capitalising on investments currently in place in terms of services in these areas. So the Department of Health here has established 11 sexual and reproductive hubs in the regional areas. Melbourne Sexual Health Centre has established GP partner clinics in outer metro and regional areas. And what we're trying to do is, in these areas that we're piloting, in the rural areas, we're going to be talking to doctors, pharmacies, pathology centres and stuff where they're saying, hey, this service is going to come in place, be aware of it because people might come to you for referrals. So here's just a picture of, these are the sexual reproductive health in Victoria where they are. And these are the existing hubs as well. So you can see they're kind of scattered around Victoria. So currently the stakeholder consultations in Victoria, we've got Melbourne Sexual Partner Clinics, the Hub, Sexual Victoria, Primary Health GPs. So we're also looking at, obviously talking to doctors and school programs, community-based organisations, supercare pharmacies and pathology labs. And the reason we're trying to do that is obviously their willingness to participate or be part of this ESTI service, because they're going to need to be there to receive referrals from people requiring further treatment, stocking and delivering of injections, provide collection and drop-off points for some kids if we do that, health promotion. So in terms of roles of pharmacists, I was a pharmacist by training, so I have some interest in this area. So these are the Victoria. These are the sexual reproductive health hubs. These are the supercare pharmacies. So you can see the kind of splatter around Victoria. Melbourne's in the middle at the bottom there. You can see Melbourne. So you can see supercare pharmacies. You can see in sort of the purple crosses and pharmacies. There's quite a lot of them splattered around. So Shepherd up there in the top right is an area that we want to try to do some testing up there. Low testing, low access, very disadvantaged area. So we did a survey of the role of pharmacists into the treatment access. So pharmacists can give, so currently Victoria pharmacists can provide intramuscular injections under current regulations, but many of them may not be competent. And when you speak to the Pharmacy Society of Australia about whether or not these pharmacists can provide injections for syphilis and gonorrhea, the law already allows them to do so, but pharmacists don't know whether they're allowed to. They think that the legislation needs to stipulate specifically if they can do that, and whether or not they stock the injections that they need. All of the pharmacists said that they would potentially test home testing kits, but only if they were used, if this increased foot traffic and community service in their pharmacies, so it would make money for them. Some would be a collection point for kits to be collected and then sent off to pathology centres. Some of them wanted to make money out of it. Other pharmacists wanted things like being able to interpret the test results and then prescribe based on the test results, which I don't think they're going to get. And I would not want that to happen. So that's evaluations. I'm going to quickly go through these. It's very sciencey. So we're going to provide community-based evaluations, an interrupted time series, evaluating the testing uptake in the community. We're doing a randomised control trial at Melbourne Sexual Centre and then a process evaluation. So this interrupted time series is basically, like I said, we're going to select and implement in several local government areas. We're going to test in 8 metropolitan and 12 rural regional areas. And we're going to select these LGAs against low testing rates, high proportion of young people, some disadvantage, moderate amounts of Indigenous populations. They definitely have a pathology centre and they have a community health centre or somewhere we can send them to get an injection. I won't go through this. This is for the statisticians who want to do it. I won't talk about it. So the outcome at the bottom is we want to see whether or not STI and HIV testing and diagnosis rates go up, and whether or not what percentage of these people that use ESTI will actually refer to a nearby service. So we're also going to try a randomized controlled trial at Melbourne Sexual Clinics in terms of whether or not clients currently there would use ESTI. So currently Melbourne Sexual is developing this digital door registration. So previously, if you walk into the clinic now, you have to go to a machine, type all your details in, all your history and stuff. So now they're asking people to do that on their phones before they rock up to the clinic. And so as they do that registration process, if they're there just for a screening process, they'll be randomized to come to Melbourne Sexual Centre or use ESTI, and we'll then look at whether or not how many people would then go to the ESTI. We're looking at about 4,000 people to randomise in this study, and the outcome here is the percent uptake within 8 weeks of randomisation and the time to first testing. So we're going to do processing, economic evaluation, acceptability, barriers and facilitators. We'll do Google Analytics, like how long someone stays on a page, how many pages they stay on a session, bounce rate. So the bounce rate is the percentage of sessions where only one page is viewed. And in terms of our website, an optimal bounce rate is about 26 to 40%. So we're going to look at people who go beyond the first page. We'll do interviews, complaint logs, demographics, and the percent of testing after with pathology form. And there's a whole part of economic evaluation. So previously studies in overseas have found that if you're using a service and you're spending money in it, if the prevalence of the people that you're capturing in the online clinic is less than what you would normally see in a clinic, it's not cost effective. So we would hope that the people using this service would have a prevalence somewhere around at least 3 or 5% of STIs, otherwise it's not cost effective. So where are we now? So basically we're now in the process of actually building the website. We've got a domain name, tested, we're doing hosting, all this website building stuff. We had to go to Alfred Health and Melbourne Sexual Health as part of this Alfred Health thing, so we've got to get institutional approval, we've got to start collecting data points, we've got to make meetings and website marketing. So now all the pieces of co-design, young people, digital marketing, sexual health, it's all coming together now, so we're in that process of putting things together. We're still yet to select the sites where we're going to do the initial testing, and we haven't yet spoken to all the local health services in full. And these are all the people in the project, and that's it. Thank you so much.